There's a couple ways this plays out. And no matter how you look at it, it's damaging to the patient. So there's layers of structural disparity and structural racism, and then there's layers of interpersonal disparity and interpersonal racism that play out. We know the medical literature tells us sickle cell patients on average wait 25% longer in emergency rooms when they present with pain. That's just the data. Um, Physician colleagues will say that they don't have biases and they treat everybody the same. Now, I'll be the first one to tell you that, in 2014, I took an implicit association test that changed the way that I practice medicine because it told me that I treat white patients better than black patients. And that was a hard realization to have in that moment as a person of color. But it's true. It's probably true. And what that did for me is it allowed me to identify blind spots that I had in my own practice and hold myself accountable for making decisions that are equitable and socially responsible. Um, and that's something that I do every day. I think that the disparities that we see come a little bit from that layer of we treat everybody the same. Sickle cell patients have hurdles that are sometimes unimaginable to many of us with the degree of absenteeism, missed work, missed school, often low socioeconomic status. That sometimes if you're treating everybody quote unquote the same, it's not going to be enough to get them to the finish line. Sometimes people from different populations need more of a push than others. So what I'm here to say is don't treat people the same. Treat people how you need to get them where you need them to be. That's number one. And of course, from the structural standpoint, sickle cell disease, no matter where you go in the country, every hospital treats sickle cell disease like a back of the bus disease. There's no program in the nationally that's saying, hey, we have the best sickle cell disease program and we're pouring all our resources into it, right? This is not cancer. This is not cardiology. This is sickle cell disease. So we really struggle with getting resources that we need to care for the volume of patients that we have in this country.